Okay, folks, we should be live and we should be recording, so we're good to go.
All right, William, thank you very much. So good evening to everybody. It's really a pleasure to be introducing tonight's topic. My name is Eric Huck. I'm the president of PA Lyme Resource Network. This evening is really going to be very jam-packed with information that's pretty critical in terms of the state of Lyme disease research in the United States. And also we will be touching on towards the end talking about Lyme and tick-borne disease legislation updates and how individuals can get involved and action items, call to action. We have two really important speakers with us tonight. Nicole Bell will be leading the first portion of the evening, where she'll be giving us an overview of the Center for Lyme Action's recently released policy paper, The State of Lyme Disease Research in the United States. Before we get right into the program, what I would like to do is give everyone a little bit of a heads up of some of the upcoming events that are coming in April and in May for PA Lyme. So I'm going to go to and do a share screen. And would that be... Bill, I'm sorry, I don't think I have. Well, does that appear that I'm sharing that?
Yes, it does.
I'm getting, actually, I'm getting kind of a different image. So are you seeing a full screen now?
Yes.
All right. Thank you, everybody. We are a little rusty. When we were doing this during COVID, every month it was the same formality. So we've had a lot of our regions have gone back to individual meetings. So we're not doing as many virtual Lyme impacts. What I want to introduce is let everybody know in 3 weeks, we're going to have a patients and parents conference. It's going to be at the Hershey Lodge, Saturday, April 6th. We're really very pleased to be having Dr. Amy Offut, who is the president of ILADS, as our keynote speaker. She's going to be talking about the state of Lyme and tick-borne disease and really what the evolution of the science and research has been that's informing ILADS into what their Lyme and tick-borne disease guidelines are. So we're pretty excited to have her. In addition, as you can see, we have 3 other presenters. Dr. Nancy O'Hara, she's recently written a book on PANS and PANDAS. She'll be talking about PAN and PANDAS, pediatric neuropsychiatric symptoms and treatment options. It's really a presentation designed for parents. If you suspect you have a child with neuropsychiatric symptoms, maybe you think Lyme, maybe you think otherwise, Dr. O'Hara really has set a lot of the foundation of what to look for and how to approach it if you're a parent of a child, or if you know other individuals, you know other parents and their children are exhibiting Lyme neuropsychiatric types of symptoms. Dr. O'Hara would look forward to meeting you at her book signing. In addition, we're going to have Dr. Bach. He's a past president of the ILADS boards of directors. He's going to be touching on the whole topic of it really isn't just Lyme. Tick-borne co-infections are many, and the way to have a really healthy treatment protocol is to look at integrative treatments, something that can do a blending of pharmacological, herbal, and other related protocols. I will speak personally that of the many individuals that I know that have gotten better or are on the road to recovery, they're not just doing purely herbals, they're not just doing purely antibiotics, they really are doing a kind of holistic approach that is an integrative approach. We also have Dr. Chris Turnpaul speaking. He's going to be talking about immune modulation and really looking at a functional medicine approach and best practices towards treating chronic illnesses. So those speakers, it's going to be really a jam-packed day. I think one of the benefits of considering coming is if you look at our exhibitors as well, we have about a dozen exhibitors. Aspire is the National Pans and Pandas organization. We have author Fred Diamond, who will also be doing a book signing, Guardian Mosquito Tick Control for your yards. Igenics will be there, Lyme Core Botanicals will be there. We're also pretty happy that Lyme List is going to be sharing a table with Rise Above Lyme. For those of you that are actively involved in social media, you're probably familiar with both. I've had the pleasure over the last couple of months of getting to know Jessica Devine, who has started Rise Above Lyme, and she has been very instrumental helping us to get the word out. We also have My Lyme Coach, Nutramedics, and Turnpaw Health and Wellness is going to be there. So it will be a full day of speakers, of networking. There will be a gluten-free lunch. All of this at the Hershey Lodge, Saturday, April 6th for $75. So you can get your tickets by going on to palyme.org or just be on the lookout. You'll be getting some information over the next couple of weeks. So in addition to this will be our 5th patient and parents conference. So PA Lyme has been doing this since 2012. Every other year, we either run an ILADS medical conference for doctors, medical practitioners that offer continuing medical education credits, or we run a patient conference. So this alternating every other year seems to be a really good approach. We estimate we're going to have 80 to 100 attendees that show up. So in addition to that, in April, May, as everybody knows, is Lyme Awareness Month. So nationally, the Lyme organizations have rallied behind using the month of May as Lyme Awareness Month. Here in Pennsylvania, Senator Michelle Brooks is sponsoring a Senate resolution to make May Lyme Awareness Month here in Pennsylvania. If you recognize the name, Senator Brooks is the author sponsor of Senate Bill 100, which is right now in the Senate, and we're hoping that it does pass the full Senate and come over to the House of Representatives. So PA Lyme has made a decision to try to ride the coattail and leverage the month of May being Lyme Awareness Month. We're going to be showing the quiet epidemic in May. We're going to be doing this at approximately 6 locations, and you can see the areas that we're going to be showing it. You can go to our website. You can stay tuned to a lot of the social media and email distribution. We will be getting the awareness out to everyone. If you're not familiar with the quiet epidemic, it is an independently produced, it's an award-winning documentary on the reality and the life and the struggle that a family up in New York went through over about a 7-8 year period of time. So Enrico Bruseski is the father. His daughter Julia is the individual that the documentary follows. So if you're familiar with Under Our Skin, if you're familiar with Monsters Inside Me, if you're familiar with Emergence, the second phase of Under Our Skin, those documentaries over the last decade or so are really very, very impactful. But I would suggest that the quiet epidemic is really that much more when you follow not only the production quality, the storyline, but the real understanding of why Lyme disease is gaslit, why there is the medical controversy, what the origin is, and what individuals have gone through to try to get better, in the face of adversity that's largely put in front of us, not only by, medical academic doctor groups, by the CDC and what have you. So the quiet epidemic, you can go online and look at a trailer. What we would ask of everybody is, these are free showings. We're not charging. We're using each of these locations as an opportunity to show the documentary and then to have a post-screening panel. Most of these locations will have a Lyme literate medical doctor there that's going to be available for Q&A. So in terms of what we are doing, gearing up for May and for the spring, PA Lyme, we hold it that we are advocates for you, the Lyme community in Pennsylvania, those that have been impacted, affected, whether yourself, your family, children. PA Lyme is a 501c3 nonprofit, all volunteer. We try to bring solutions and resources to you, to obviously the Lyme community here in PA. And that brings us up to ending with the housekeeping and going into really the meat of the program. Knowing that when we first had an opportunity to look at some of the research that was happening by the Center for Lyme Action, we had the ability to participate and view a webinar that was done in conjunction with ILADS. When we spoke to some of our group in Pennsylvania and a lot of our membership, we recognized that not everybody had an opportunity to see it. That's why we're holding it today, because it's that valuable. So what I would like to do is introduce our first speaker, and that's going to be Nicole Bell. She's originally from Boston. She has earned a bachelor's and master's of science in science and engineering from MIT. She also has a master's of science in biomedical engineering from Duke University. So a pretty medical science background, and right from the gate, that's a good starting point for a presenter for this type of research. She's also the author, entrepreneur, and advocate for tick-borne and neurodegenerative diseases. Over the last 15 years, she's advanced her career as an engineer and program manager in medical devices and medical diagnostics. When her husband became chronically ill, she took on the most challenging role as a caregiver and medical proxy for her husband. She is the author of What Lurks in the Woods. It's a wonderful book. It really lays out the journey that a lot of us either have gone through or certainly were aware of. And it details the harrowing experience. It seeks to help others navigate chronic conditions. She has recently joined Galaxy Diagnostics as the Chief Business Officer to commercialize the advanced diagnostic methods for tick-borne diseases. We are seeing that the labs that are really starting to specialize in Lyme and tick-borne illnesses, there's maybe a half a dozen of those, Galaxy being one that we always refer to and really believe it's one of the better ones as well out there. So Nicole, I want to thank you very much for participating in this. With that, may I turn it over to you?
Great. Well, thank you, Eric, for having us today. I am going to share my screen, and hopefully that will work effectively. Okay. Can you see my screen?
Yes, we can see.
Great. Okay. So again, thank you for having me today, and thanks for everybody who's in the attendance, and for your interest in Lyme disease. That's really a growing epidemic that's, I'm sure, touched a lot of the people on the webinar in pretty impactful ways. So, as most of you know, Lyme disease has been a named disease for about 50 years. And in that history, there's been a lot of debate and confusion over some pretty fundamental issues affecting patients, millions of patients. And so despite federal funding on the topic, there's actually been a lot of great research that's made key advances to our knowledge and understanding of the disease. And the Center for Lyme Action wanted a review of this research, highlighting key findings and critical questions needing further study. And they also wanted a summary of this research to be accessible to the general public, particularly members of Congress, so that CLA could use it as a vehicle to request more funding. So about a year and a half ago, Bonnie asked me if I would take on this project to write this paper. And so for those of you that know the space, it's complicated. And when Bonnie first asked me to do this project, it seemed really daunting. But I decided to go for it and was able to leverage a strong foundation by lots of people from the Tick-Borne Disease Working Group and other places, and also some fantastic experts in the space who helped review the paper. So we launched the paper in July of last year, and we're going to review some of those highlights today. But before I dive in, I find it's always helpful to start with the why. And the why here is that misdiagnoses lead to tragic outcomes. So like many people, I was blissfully ignorant of tick-borne illness for most of my life. And then, as Eric mentioned, it hit my family. Not suddenly like it does for some, but slowly over time. You know, my husband, Russ, changed right in front of me, becoming moody, irritable, depressed. And eventually I realized that his memory was also failing. He was a brilliant electrical and computer science engineer, but all of a sudden he couldn't remember the 4-digit code to our house alarm. We tested him for Lyme disease, but he tested negative, only one of the 5 bands on the Western blot. And after bouncing from doctor to doctor, he was diagnosed with early onset Alzheimer's disease, something that didn't make any sense because he had no risk factors or genetic predisposition to the disease. 15 months later, we had him retested and found that Lyme and other co-infections were in fact the problem. But by that point, he was in late stage disease and treatments couldn't pull him out of his decline, and he passed away in January of 2022. So on the right, a lot of you may have also heard of Dr. Neil Spector. So he was a healthy trail runner in the prime of his career as an oncologist at Duke University. And then he presented with 3rd-degree heart block and needed a pacemaker installed to keep him alive. He had the same infection as Russ with Borrelia and Lyme disease, but he had a completely different phenotype showing how varied symptomology can really be. Like Russ, he also tested negative for the disease, and he tested negative actually multiple times. Eventually, he had a high enough titers to trigger the antibody test, but he needed a heart transplant because his heart had been ravaged by the bacteria. He lived another 10 years, but he passed away at the age of 63 due to the disease, the toll the disease had taken on his body. So this is the why, right? And I know a lot of you all have your own stories out there, and they can be really quite daunting, but this is why it's important to understand the state of the research and to also get more research within the space. Because I'd like to say that, you know, what I've talked about are isolated cases, but we know they're not. You know, conventional knowledge says that about 500,000 people are diagnosed and treated annually in the United States, but those are just the people that are diagnosed and treated as reported through insurance claims. Countless others work outside the system to get well, and then there's the potential for millions more who are misdiagnosed. It's a massive burden on the public and the healthcare system, and it needs to be solved. And I know this is a huge issue for Pennsylvania, which is the top state in the nation in reported Lyme disease cases. So the CLA paper touches on a host of topics, and I won't be able to cover all of them on this webinar. I wanted to focus on the top 3 areas that I thought would be of interest. First is diagnosis. You know, this is a huge challenge, and I'm sure lots of people have dealt with this personally. Second, I want to highlight some of the research linking Lyme to chronic conditions, because this is a key area where we need more funding and more research. And finally, there's treatment. I want to provide a brief overview of the challenges in that space and then highlight some of the new approaches being advanced in the lab. So first, again, diagnosis. Now, one thing that's critical to understand about Borrelia is that the bacteria is elusive. It actively suppresses and evades the immune system so that it can survive within the host. So on the immune suppression side, it has a lot of different tactics. It inhibits the complement system, which is our frontline immune defense. It induces immune cells to release anti-inflammatory cytokines to dampen the response. And it also releases antigens to neutralize antibodies. Think of them as like little depth chargers behind a submarine, right? Then there's also immune evasion tactics. So here, the bacteria can change the expression of surface proteins to confuse immune cells. It actually physically swims faster than any of the immune cells, very literally evading our immune system. And then it also hides in immune privileged sites like the joints, the eyes, and the brain. So the bacteria is highly adaptable and sophisticated, and over millions of years, it's figured out how to survive in an array of hosts, from cold-blooded insects and reptiles to warm-blooded birds and mammals. So why is this where I just start a discussion on diagnostics? Well, research shows the plethora of ways that Borrelia has to evade the immune system. Yet the current standard of care, diagnostic, is based on what? It's based on antibodies, or the immune system's response to the bacteria. So not only do we have a highly elusive pathogen that likes to evade the immune system, but we also have a massive amount of variability from person to person and how their immune system will respond. So the result is massive misdiagnosis rates. And studies have shown that the standard two-tier test and the modified two-tier test that are recommended by the CDC are only 40 to 60% accurate. This means about half of the people will get misdiagnosed, which really isn't acceptable in any other disease state. And with in vitro diagnostics not meeting the need, doctors are left with rash presentation as the primary means of diagnosis for acute disease. But the problem here is that rash presentation also has variability. Studies show that rashes can vary drastically based upon sex, body location, age, and ethnicity. Also, some patients don't present with a rash at all. In the paper, we compiled rash presentation rates with the likelihood of proper diagnosis based upon the rash. This analysis was based on a series of studies that are referenced in the slide. Now, when you walk through the flowchart, the result indicates that 52% of patients are likely to be misdiagnosed based upon the EM rash. Furthermore, the bullseye rash that's synonymous with the disease, it actually only occurs in about 14% of patients. Again, a massive challenge in determining which patients are actually impacted by the disease. So fortunately, we have emerging solutions, both commercially and in the research lab. So Jason Bobe worked with a series of Lyme experts and wrote a fantastic review article on Lyme disease for the Frontiers of Medicine. He categorized emerging assays in 4 categories, which we leverage and use in the paper. We can't unpack and didn't unpack all 4 categories in the paper, and we can't do that here either, but we were able to highlight a couple of promising techniques that could be transformative. So the first is in direct detection. So antibodies are an indirect technique because it relies upon a host immune response. In direct detection, you're looking for direct evidence of the infection, either through DNA or RNA or other molecules that are specific to the pathogen. So think about COVID, right? If you want to see if you have an active case of COVID, you don't get an antibody test, right? I have antibodies to COVID, but I don't have an active case of COVID right now. You get a PCR or an antigen test. The challenge in Lyme is that this has been difficult because the bacteria are so elusive and they actually exist below the limits of detection of conventional direct detection techniques. Fortunately, researchers at George Mason University helped to solve this problem by leveraging the fact, first, that Borrelia tends to colonize in the bladder, and then second, they use sample concentration techniques to actually increase sensitivity. With these methods, they were able to show 100% sensitivity and 98% specificity for acute Lyme using that antigen, the OspA antigen in urine. They were also able to confirm infection in chronic post-treatment patients, demonstrating infection after treatment. And I'll come back to that in the treatment section. So the team at George Mason continues their research and actually were recently awarded a grant through the Lyme Action Challenge. And the assay has been made commercially available by Galaxy Diagnostics, which is one of the many reasons I decided to join the company. Another novel approach being developed at Duke University is based upon an imaging modality. So this work is actually out of the lab started by Dr. Neil Spector, who I talked about earlier in the presentation. And it uses the tools and techniques of cancer research in the Lyme world. So here, researchers target a highly conserved and specific protein called HTPG, which is expressed on the surface of Borrelia cells. They then bind imaging agents to the HTPG protein and can selectively label the bacteria for subsequent detection. This approach has been demonstrated in a mouse model using fluorescence, but future work targets combining the technique with PET imaging so that you can use it to pinpoint the location of an infection. So this technique could be transformative in complex cases to establish causality of complex symptoms and to drive targeted treatment. So next is the link to chronic conditions. So we've established that Borrelia is elusive. And the other thing to understand about Borrelia is that it can travel throughout the body and it can cause conditions across multiple body systems. The link to dermatologic conditions and rashes has been pretty well established. And there's also a lot of literature about Lyme arthritis and how the infection can lead to joint pain and swelling. But there's two key body systems where more research is needed to understand how this bacteria links to disease, and that's the brain and the heart. We know that we have neurological Lyme, and there are pretty severe impacts. We also know that Lyme carditis is severe and leads to tragic outcomes. But with the massive misdiagnosis rates that I discussed earlier and new research in the space, it's become clear that the story might be bigger than traditional medicine would lead you to believe. So first, the brain, right? The blood-brain barrier is a layer of specialized cells that are supposed to protect infection and other insults to the brain. But scientists have known for over 100 years that this barrier is not infallible. So Borrelia is in a class of bacteria known as a spirochete. And spirochetes were first discovered in the brain back in 1913 when a Japanese scientist identified the spirochete causing syphilis in brain tissue. Borrelia is also known to cross the blood-brain barrier, and this has been documented by multiple methods, including culture, PCR, and labeling in tissue sections. So the figure on the right shows fluorescently labeled Borrelia in the brain of a rhesus monkey. And note that these bacteria were found after treatment with the standard course of oral doxycycline, which is something that we'll return to later. So there hasn't been a systematic study of what happens in the brain and how Borrelia leads to disease, but we do have smatterings of findings in the literature over the past 3 decades. Fortunately, I didn't have to wade through 30 years of material because the panel of experts in the Federal Tick-Borne Disease Working Group did this back in 2022. So they found a host of case reports and studies linking Lyme to psychiatric manifestations and cognitive issues, and recommended that Congress fund additional studies to understand the link between Borrelia and these costly chronic conditions. So just to highlight a couple of these key findings, in 2021, Dr. Brian Fallon from Columbia University used a nationwide Danish registry to determine if patients with a hospital-based diagnosis of Lyme disease had an increased risk of subsequent psychiatric disorders. He found that people diagnosed with Lyme had a 28% higher rate of any mental disorder, a 42% higher rate of affective disorder, 2 times higher the rate of suicide attempts, and a 75% higher rate of death by suicide. With the growing mental health crisis in America and worldwide, this is a critical area needing further study. So another condition near and dear to my heart because of my husband's condition is dementia. So clinical case reports and autopsy studies have linked Borrelia to dementia for decades. One of the silver linings of COVID is that the scientific community has actually embraced that chronic infection can lead to cognitive decline. And in fact, research at Harvard University demonstrated that the amyloid beta plaques that have become synonymous with Alzheimer's are actually a response of our innate immune system. So the question is, the response of the innate immune system to what? So the question is so intriguing that a consortium of scientists called for an investigation of the link between key microbes, including Borrelia, and Alzheimer's disease. And this was a protocol or a call for a consensus protocol that was published in 2023. And they're searching for funding and for research collaborators now. So next is the heart. right? We talked about Dr. Neil Spector, and it's been well documented that Borrelia can infiltrate the connective tissue around the heart and cause Lyme carditis. This condition is extremely severe, and atrioventricular or AV block is the most common presentation and leads to high degree block in about 2/3 of cases. If untreated, the condition leads to pacemaker implantation and even death. So Lyme carditis is generally thought of as rare, with an incidence of about 1.5% often cited in the literature. But it's important to note that this percentage is based upon a very specific subset of CDC reported cases, and so the inputs are limited. On the other hand, high-degree heart block is one of the most common conditions leading to the implantation of nearly 250,000 pacemakers annually. And half of high-degree heart block is caused by idiopathic fibrosis. Idiopathic is one of my favorite words in medicine because basically it's a fancy way of saying that we have absolutely no idea what's causing your condition. So in 2022, 130 patients with idiopathic AV block were actually tested for Lyme disease. 23% of those patients showed antibodies for Borrelia, and 12% showed antibodies consistent with recent infection. So 23% is a pretty big number, especially when we know that the tests are not very accurate. So the question that we posed in the paper is there's 10 million people suffering, 10 million Americans suffering with chronic mental illness. We have 6 million people suffering with Alzheimer's and 3.1 million from heart disease. How many of these cases are linked to a treatable infection, right? An infection that could be treated and cured, and we could remove people from the chronic disease registers if we understood what was causing their illness and how to properly treat. Even if the percentage is small, the implications for the healthcare system could be huge. And I know that the implication for each individual family is life-changing. So finally, we have treatment. And I'd like to point out that I am definitely not a doctor, so I'm going to keep the discussion to the literature and the guidelines. And one thing that's clear from multiple studies, only one of which I highlight here, is that it's actually easiest to treat the earlier you diagnose the infection, right? The literature refers to Lyme in different stages. First, you have early localized disease, then early disseminated disease, and then late disseminated disease. And the later it gets, the harder it is to treat. Patients with a delayed time to treatment, and delay is not long, it's greater than 30 days. Those patients are over 2 times more likely to develop persistent symptoms. And with the diagnosis statistics that I highlighted earlier, this is a tough finding because there's so many factors working against an accurate and early diagnosis. So what is the recommended treatment? Well, that's not a topic that we can completely unpack here, but the IDSA guidelines for treatment, by their own admission, leave huge holes, right? This slide shows a summary of recommended treatments by clinical presentation and the grade approach that they use to rate those recommendations. And when you look at those recommendations and the ratings, note that high quality evidence is lacking for all disease states. And several disease manifestations have weak recommendations with low or very low quality evidence. But what happens when patients are treated, ideally, right, with the standard guidelines? A study out of Johns Hopkins University in 2022 showed that even in ideal condition, treatment fails a significant percentage of patients. So what do I mean by ideal? Well, they looked at 234 patients who presented with an EM rash. So they know that they had Lyme disease because they had the typical EM rash. And then they received timely treatment with deoxycycline. Of those 234 ideally treated patients, 43% experienced persistent symptoms and 14% experienced persistent symptoms that impair their quality of life. So these are pretty big numbers. These are known treatment failures, and this has led to a research case definition known as post-treatment Lyme disease. And studies estimate that there are over 2 million Americans living with PTLDS. So PTLDS and persistent Lyme has been a subject of debate, and several potential causes have been suggested. So I've included a list here with references, and some of the thoughts behind why we have this condition are listed here. So it's first, infection-induced immune dysfunction, autoantigens and or CNS or central nervous system sensitization, inflammation due to persistent bacteria, or inflammation due to persistent bacterial debris, and then finally inflammation due to other infections. So lots of science supporting these different mechanisms, and I think it's important to note that they've all been sufficiently supported in the research, and the likely answer isn't just one of these causes. It's likely that different causes occur in different patient groups, and that multiple causes can actually occur within the same patient. But out of that list, persistence after antibiotics has been hotly debated in the research literature. And through the work of some talented researchers at Tulane University and other top centers, I would say that there's now overwhelming evidence that Borrelia does persist after antibiotics. This has been demonstrated in cell cultures, in animal models, and in human studies. So one notable finding is shown here in the pie chart. So this study uses the NanoTrap antigen assay that I referenced earlier in the diagnostic section. And this study looked at 100 PTLDS patients who were all CDC criteria negative. Antigen testing revealed that 41% of those patients were antigen positive, implying that a significant percentage, but not all, of the patients with PTLDS were dealing with persistent infection. Others may be dealing with the other causes listed on my previous slide. And further research is needed to truly figure out what is impacting each patient. And several researchers have looked at alternate therapies. That imaging technology that I showed earlier out of Dr. Spector's lab at Duke, well, instead of binding HTPG with an imaging agent, they've also demonstrated that you can bind it with a toxin that selectively binds to Borrelia and triggers cell death. This small molecule, HS291, has been demonstrated in cell cultures and is moving into animal studies. Other researchers have looked at other antibiotics and combinations of antibiotics, which have shown effectiveness in eradicating bacteria, the Borrelia bacteria, in cell culture and animal models. At the beginning of this year, hygromycin A moved into phase 1 clinical trials to test safety and dosages in human patients. So the lower study on the graphic was actually not referenced in the paper since it was released last year after the paper was launched. But this is a notable study out of Tulane University showing that 4 dual combinations and 3 triple combinations of antibiotics effectively eradicated persistent Borrelia infections. This study is also notable since none of the monotherapies, in other words, no single antibiotic that was tested, were effective at eradicating the bacteria. And it's also important because the authors went out of their way to confirm clearance through multiple testing modalities, since, as we've discussed, testing is a challenge. So the moral of the story on the state of Lyme research is that we need more research. This area of science has been dramatically underfunded, and the implications are likely to expand across the healthcare system well beyond what people traditionally consider as tick-borne illness and into other multiple types of chronic disease states. And so with the release of this paper, CLA challenged Congress to allocate $500 million to $1 billion per year for tick-borne disease research. And we believe that there are many promising solutions out there, but more funding is needed to bring them from the lab to the bedside. The topics in the paper were broader than what we covered today, but the core recommendations focus on increasing research funding in 3 core areas. So first, diagnostics, which we talked about. We really need solutions that are sensitive and specific for the detection of Borrelia and other tick-borne infections. Second is alternative therapeutics to treat acute, late-stage, and persistent Lyme disease. And then finally, clinical studies to better understand the mechanisms for Borrelia persistence and its tolerance to antibiotics. The paper also recommended building a national repository of human samples for Lyme and other tick-borne illnesses, because this is a key resource for researchers and companies working to innovate in the space. So with that, I will pass it back to Eric, who will introduce Bonnie, and she can cover how you can work with CLA to help drive this change.
Thank you, Nicole. I love the opportunity that we can actually get access to that information. So thanks for providing that. Allow me to introduce Bonnie Crater. She's the co-founder and on the board of the Center for Lyme Action. Her specialty for this evening is going to be to get into the Lyme and tick-borne disease legislative updates and kind of where we are and where we want to go. So Bonnie is also a co-founder and co-chair of Bay Area Lyme Foundation. She's the former chair of the BAL Science Committee, which drives research and innovation to chart new paths in Lyme research. Bonnie is a two-time tech CEO, multi-time vice president of marketing in Silicon Valley. She currently serves on the board of the CB Wellness Foundation for the town of Portola Valley in California. And Bonnie holds an AB in biology from Princeton University. Bonnie, thank you very much for joining us.
Thanks, Eric, for having us. It's really terrific to be able to address your group. I am going to share my screen here. And I'm going to ask, can everyone see my screen?
Yes.
Excellent. Okay, great. Well, first of all, thanks, Nicole, for a great presentation. I actually have some good news on your last point. I learned a week ago that the CDC has funded a new biorepository, given all the work that our Lyme advocates have done to increase the CDC budget. Some of that money has gone to fund a new Lyme biorepository. So that's very exciting, and we should see some in the next year or so. We should see a new asset for researchers to work on diagnostics from the CDC. So again, Eric, thanks for inviting me. I'm Bonnie Crater, and I'm co-founder and of Center for Lyme Action. And if you are involved in Lyme disease and want to do more, I want to introduce you to Center for Lyme Action and tell you about some of our successes in Washington, D.C. and how you can help. But first, a little bit more about my story. I started Bay Area Lyme Foundation with my friend Lori Woods about 12 years ago, and it's now grown into the #1 public charity funding Lyme disease research in the United States. But $45 million and 150 research projects later, we realized that we really needed much more help on this problem. For a complex disease like Lyme disease, Lyme and tick-borne disease, we really need to leverage the power of the federal government. And so thus, we have Center for Lyme Action. So here's our story. This is a story that you all know well. This is the world that we live in. Each year, the number of cases on average goes up for Lyme and tick-borne disease, particularly Lyme disease. And the number of cases is nearly 5 times the number today that it was in 1991. And unfortunately, the funding for the federal government continues to be rather low, despite the fact that we have so many cases, 476,000 cases of Lyme disease each year. The per patient funding is this paltry $82 per patient, and that's pretty terrible compared to other much less common infectious diseases like West Nile, $6,870, or malaria, $150,000. So you can see that we have a very compelling case to ask for more federal funding, particularly in the light that we don't really have a really strong and reliable working diagnostic or a therapy, particularly for those who have had Lyme disease for a very long time. And so thus we have the starting of Center for Lyme Action. So we started this in 2019. Center for Lyme Action is a special type of nonprofit called a 501c4. And a 501c4 is set up so that you can do unlimited lobbying to the federal government. The mission of the organization is to grow federal funding for Lyme and tick-borne disease and conditions. We're including, of course, alpha-gal in our work as well these days. Our strategy is to leverage professional lobbying techniques. So we have hire professional lobbyists to advocate for Lyme and tick-borne disease research in both the legislative, so in Congress, and the executive branches, which would include the agencies like the NIH or CDC or DoD. So I'm a big promoter of values. When we start an organization, I like to kind of have a set of values which basically outline what we stand for and how we show up. So our first value is that we're bipartisan. We don't care whether you're a Democrat or Republican. We talk to everybody. We want to be inclusive. Our friend Kristen Honey in HHS always says the ticks don't care if you're a Democrat or Republican. They are equal opportunity biters. So bipartisan is very important to us. We also want to be very inclusive because there's lots of opinions and points of view about Lyme and tick-borne disease. And so we try as hard as we can to be inclusive of all points of view. We also recognize there are a lot of sick people out there, so we want to try to operate in a very humane way. And then lastly is we believe in science. We believe that science will solve this problem. We are a member-supported organization, and so I want to particularly highlight and thank our charter members and grantors who fund our operation. The first is Alex Cohen, Bay Area Lyme Foundation, Project Lyme, the Fairbairn family, Lori Woods, and the Driscoll Family Foundation, who actually funded the State of Lyme Disease Research paper. So thanks to them, we have that paper available for everyone. Okay, so we started this operation, and what are our results? Well, it's actually been pretty exciting. I didn't imagine that it would actually be this good. So when we started the organization, we had the Lyme and tick-borne disease was funded at about $59 million a year. We're now up to $178 million, which is great. And we've set new records in FY23. Of course, we're in FY24 right now. So today, the new fiscal year starts October 1st and ends September 30th. So we're actually technically in FY24, but FY24 budgets have not been approved by Congress yet for the two appropriations bills that we care about most. And that's the Defense Appropriations Bill and the Labor HHS Appropriations Bill. But anyway, so the latest results that we have right now are FY23, and we set new records for FY23, $52 million for the CDC, $119 million for NIH, and $7 million for CDMRP, which is the Defense Department research budget for tick-borne disease research. So here's our chart. This is the annual appropriation summary. You can see here on the left-hand side, these are the agency listings. We have CDC, NIH, and the Department of Defense. Those are the main agencies that we fund, or that we fund, but we are advocating for funding and programs in these areas. Then these are the budget years. So this is fiscal year 2020, 2021, 2022, and 2023. And you can see what I just said, which is we started out at 59 million, and we're now at 178.5 million on an annual basis. The total impact has been quite large. $282 million so far since we started. So that's really awesome. And it's not just me and the other folks at Center for Lyme Action. It's all the advocates that work on this. We have 2,000 advocates across the United States. Some of you on the call today may be advocates as well. And if you are, we really thank you a lot because we can't do this alone. This is totally a team sport. We need advocates from every state in the country to come work on this with us and click on things, and we're super grateful for all of the work that everyone has done. Going back to our slide here, we have, so CDC has two main line items. One is vector-borne. The K-Hagen Tick Act, some of you may know, was passed in 2019, just after we started Center for Lyme Action. That was our first project that we worked on. And that was a project that was a bill that was initiated by Senator Susan Collins from Maine. And the K-Hagen Tick Act really kind of got us all started. It's authorized at $30 million a year, and it funds the Centers for Excellence. They do tick studies around the country in these different centers, and then also provide scholarships for doing surveillance in different states. Lots of states have trouble actually counting the number of Lyme patients. Anybody who's looked at the numbers know that they're quite off. The CDC is doing the best they can to try to get them right. But a lot of states have trouble actually doing the counting because they don't have enough funding to fund the counts. So the KAG and TICAC helps fund those things. We started off for FY20. That was when it had just passed. It was zero, and now we're up to $18.5 million a year. This second line item here, training, evaluation, and partnership centers. That looks like it's going to be that's like a one-year program that was done last year in FY23, $8 million. The key line for things that we're interested in, this Lyme and tick-borne disease line item, started out at 14 million when we started, and now the CDC is funded at 26 million. So there's a lot of new programs that the CDC has been able to fund, including that program that I just mentioned, which is to fund a new biorepository, which is really exciting. So the NIH is the main source of research funding for almost nearly every disease in the United States. And so we are actively working to try to make that pie bigger for Lyme and tick-borne disease. So that has grown from $40 million to $119 million. The line item for Lyme disease has grown to $52 million. But I actually did an analysis a couple of weeks ago and looked at this $119 million. And that $119 million and that $52 million number is actually not is actually higher. It's about $70 million of this $119 million is actually projects that are Lyme disease projects. And then lastly is Department of Defense. There's a CDMRP program. So military personnel crawl around in the grasses, bushes, and so on as part of their training. And they're very at high risk of getting Lyme disease. So the Department of Defense is very interested in funding research for Lyme disease to see if they can contribute to the innovation for getting better diagnostics and therapies. That started out at $5 million years ago, and now we're up to $7 million. We'd love to see more money there. Okay, now FY24. If you guys have been looking at the news, you may have seen that there was an announcement yesterday that that Congress is closing in on FY24 appropriations bills, both the two that we're mostly interested in. So those two, again, are the Defense Appropriations Bill and the Labor HHS Appropriations Bill. And so right now, this is where we stand. We're still early days. We do know that there was a couple of very interesting things that I'd like to point out. One is that, and it's not on this slide for some reason. Okay, well, the House, I guess I just didn't update the slide. Anyway, the House Appropriations Committee for NIH said, not TBD, but they said, NIH, we really want you to spend a minimum of $125 million on Lyme and tick-borne disease. So that's very unusual to say that. So we'll see what happens with that. And then the KHAG and Tick Act was funded by the Senate Appropriations Committee at 27.5. So we're getting to that, close to that $30 million on an annual rate appropriation for that. So anyway, we'll see what happens coming up. This Friday is the day that the continuing resolution, that's the thing that says, okay, we're going to fund at FY23 levels, even though we're into FY24. We'll see if that's what happens with that bill, those appropriation bills, if they hopefully get passed by Friday. There is one more thing I wanted to mention, and that is Lyme X. So Lyme X is a program that Nicole mentioned that's going on in HHS. It's been funded entirely, almost entirely, not entirely, but almost entirely by a grant, a generous grant from the Cohen Foundation. And we've been asking Congress to fund additional $5 million for Lyme X, so that that program could be, the federal part of the program can be funded. And in the House Appropriations Committee approved the $5 million. And so we'll see if that also ends up in the bill or not. So fingers crossed, we'll have some more good results to announce next week. Okay, so other good news, things that are happening is because we've seen these pretty big increases in funding with the NIH. Last year, the NIH awarded 7. It says 5 here, but they actually awarded 7 by, and this announcement was July, but by September they awarded 7 R01 grants. An R01 grant is a grant that every researcher wants. It's a multi-year grant, a 5-year, up to 5 years, and it generally is funded somewhere between $500,000 and $1 million. And so there were 7 of these awarded in the area of chronic Lyme disease, in the area of persistent Lyme disease. These guys call it post-treatment Lyme disease, but that's what they mean. This is a historic, never been done before, and it's because of the increases that we're seeing in the NIH for Lyme and tick-borne disease. The projects are quite interesting, and we're excited for these researchers that have worked hard to get basic data to be able to win the grants and to help us move the ball forward. So Brandis Jutras from Virginia Tech, Mickey Tall from MIT, Lyndon Hugh from Tufts, John Alcott from Johns Hopkins, and Neil Woodbury from ASU. And the 2 additional ones were Cheryl Marble also from Johns Hopkins, and then Rafael Tukars from Columbia. So the total in these brand new, never done before, persistent Lyme disease grants was $4.1 million in the first year. And so that's expected to be somewhere north of $15 million over 5 years. So congrats to all these researchers. Okay, so how do we do it? This is a chart which shows the regular operations for Congress and how appropriations are approved. So the first step is that the president's budget is introduced in February, typically, right after the State of the Union address, which is typically in January. This year, of course, State of the Union address was pushed out, so the president's budget was actually introduced in March. But basically, that's the first step. So the president or the executive branch proposes what the budgets should be for FY25. So now we're working on FY25. So now we're actually in budget hearings, and so if you can see on websites for the appropriations committees, they're starting to have hearings on the various appropriations bills. So tomorrow, for example, the House Appropriations Committee is having a hearing for the labor HHS bill. There's also after that, there's Appropriations Committee markups. These are the edits to the bills. Then there's a vote on the floor, and this happens simultaneously in both the House and the Senate. Then once they have bills, they will have a conference, and then the final appropriations bills are signed into law. So of course, this is kind of regular order. If things go perfectly well, the budget is wrapped up by September 30th. So October 1st, there's a new set of budgets for the federal government to work with. Okay, so how does Center for Lyme Action work? So we mirror a lot of these activities with our activities. So in February, we hold a fly-in. So we held a fly-in a few weeks ago. We had around 400 people sign up and participate in meetings with their members of Congress. We train all the folks in various training sessions, including a storytelling session this year that was new for this year. And the meetings all happen basically on one day, on a Wednesday, where there's literally hundreds of meetings with members of Congress on the same day. So we're now post fly-in. So one of the key steps is we have to fill out forms. If you don't fill out the appropriations forms from the constituents in the districts, then the requests that we make don't go anywhere. So if we fill out forms, and every year there's well over 1,000 forms that get filled out. And again, this year won't be any different. We then send letters to members of Congress. We send Lyme community letters, and we send letters to the conferees when they're doing conference. And then hopefully at the end of the year, we can celebrate. And so far, we've had a lot to celebrate, which has been great. So as I mentioned a few weeks ago, we had our 2024 virtual Lyme fly-in. We do it by Zoom, so to allow lots of people to participate. And so we held 283 meetings with Congress. This is a group from California. They're meeting with their Senate, with one of their senators. This is a total number of people was 383 people actually had those 283 meetings, representing 45 states and the District of Columbia. And as I mentioned, we're now submitting our FY25 appropriations forms to the House and Senate office with a lot of help from a lot of these people right on this screen. What's cool about the fly-in is that over 50 independent Lyme organizations, including folks from PA Lyme, participate in the fly-in. So I want to thank all of you that participated in our fly-in this year. We're super grateful for the time you spent. Hopefully we'll have another good result. But if you are not familiar with Center for Lyme Action, this is how you can get involved. So first is you can go to our website and just sign up for our mailing list. So you go to the website and just scroll down, and you should see a pop-up so you can sign up for the mailing list. You can become a member. So we have our charter members that I alluded to previously, but we have individual memberships for even for $30 a year. So feel free to become a member. And then we have events. We do our fly-in every year, of course. We also have a couple of live events. Our next live event will be in Washington, D.C., and we're going to address the topic of Lyme and military readiness. We're holding this event in the Rayburn building in the afternoon on June 5th. We haven't actually announced this event on our website yet, and that will happen in the next couple of weeks. But save the date, June 5th. If you can make it to Washington, we'd love to see you. Okay, that's my presentation, Eric, and I'd be delighted to answer any questions that anyone has.
That's great. Thanks, Bonnie. I failed to mention earlier in opening this evening that if you do have any questions, either for Nicole or for Bonnie, please go down to the Q&A section at the bottom of your screen, and you can go ahead and just list your question right there. So I know that we're going to be getting questions in through Facebook. I do see that there are some questions there. I've been getting a couple of questions texted to me. So Bill, if I can kick it over to you to start us off for the questions.
Certainly. And as Eric said, if you have questions, you can use the Q&A feature here in Zoom. If you're on Facebook, just leave a comment and we'll catch you there. The first question is, and I'll just throw these out, Bonnie, Nicole, whoever wants to field these questions, feel free to jump in. Will the drug HS291 be patented for Lyme disease specifically if approved, or is it too early in the process to answer that?
So I don't know the answer to that offhand. I mean, it was coming out of the Duke University, like I said, Dr. Spector's lab, and now Tim Hasted is taking over that research. Duke is generally pretty patent savvy, and so I would imagine that there would be something there, but that's a think, not a no. And that would really be a question we would have to follow up with Dr. Hasted on. I don't know, Bonnie, if you have any more information, but I do not. I've just read the papers.
Yeah. Let's see. Where did that question go?
Oh, I think he answered it.
Oh, sorry about that.
Okay.
Yeah.
I can read it to you again. It was, will the drug HS291 be patented for Lyme disease specifically if approved, or is it too early in the process to answer that?
Yeah, I would agree with Nicole that Duke is a very patent savvy operation, and I'm sure they filed provisional patents on this to be licensed by some company to take it to market. The project was actually funded by Barry Lyme Foundation in conjunction with a bunch of other large donors, and is a multi-part project, not only the drug, but also the imaging that's also being done in collaboration with Tulane University. So it's actually a pretty exciting find, this HPTG find, where you can use that molecule for both potential therapy and a diagnostic.
And for anyone who's interested in learning more about that, I actually did an interview with Dr. Hasted that's on the Lyme Warrior website, and they have we talk a little bit more about the research, both for imaging and for for treatment modalities.
All right, thank you. We'll go on to the next question. Why can some Borrelia infected individuals be asymptomatic?
Yeah, so this is, and we've seen this with not just Borrelia, but with other tick-borne infections, is that there's evidence of subclinical infections. The way that I like to think about it is that your immune system, right, has a pathogenic burden that it can handle, right? And at some point you might, you can keep those infections at bay, and you can keep them below the level where you're having kind of a chronic or some sort of debilitating symptoms. But the immune system, if you reach some sort of tipping point where either you have too high of a pathogen burden, or you achieve some stress in your life, or you have an accident or a physical injury, then all of a sudden the tipping point of your immune system gets out of balance, and then the infection can propagate and become a clinical infection, leading to pretty massive symptoms. And so that's what has been experienced. That's what I've seen with folks that I've engaged with. But again, I'm not a doctor, so so I can't answer specific questions on a particular patient or anything of that sort.
We do have a stat from the Lyme Disease Biobank, which collects samples from the East Coast and Midwest and West Coast. And that is that about 2% of folks that are in the controls, meaning they think they do not have Lyme disease, test positive for Lyme. And so, which is kind of interesting, that 2% of people that are, think that they're completely healthy and never been exposed to Lyme disease have had some, have actually have an immune reaction, so that they have antibodies.
All right, thank you for that. Now we have a very simple but very profound question from Facebook. How can we help? I know you talked about your mailing list and a few other things, but maybe just touch on the people listening out there. How can we help?
Well, the first thing is every year we run this fly-in in February. It's actually kind of a lot of fun. I've met tons of great, really nice people doing it, and we have a terrific group of people that are asking for more federal funding. So sign up to fly-in. It is a bit of a commitment. You're committing a day, basically, to do 3 to 5 meetings with members of Congress. And then there's a couple of training sessions, because you want to try to familiarize yourself with the material. We now have team leads, regional team leads, that are organizing groups in the different regions. But that's a great way to start off and help. Also, come to our events in Washington, D.C., meet congressional staff, tell them your story. Everyone's got a story, and those stories are really powerful. So I encourage everyone to participate. If you sign up for the mailing list, from time to time there'll be letters and actions to sign. It's like a 5-minute thing. You read it, click on it. You might write a bit about your story in the letter to your member of Congress. And so those types of activities happen a couple times a year.
And I would say, so I've participated in the fly-in for a couple of years now, and I would say it can be a little daunting if you haven't done it before, right? You're like, well, I get to talk to congressional staffers and I don't really know what to do. I would add that, CLA does a fantastic job of prepping you for what you should do and pairing you with people who have done it before. So really your role is to just show up, share your story, and then, generally you'll have someone else there in the meeting, a team lead or so forth, that can help you with the asks and so forth. So it's not anything that anybody can't manage. We've had some people that can't make all 5 meetings in the day and just join for the couple. And so I would encourage you to get involved and to help out, because it's a really fun process, and you get to meet some people in your state that are like-minded and, you know, great to connect with.
Very good. Thank you. Next question. Typically, once if federal funding is increased, does that typically correlate to increased individual state funding based on need?
I guess I'll jump on this one. So, yeah, so the federal process for federal funding is completely separate from every state in the country. There are some opportunities where the federal government does subsidize some activities in states. And that's, for example, I mentioned the KHIG and TIC Act, where a bunch of health departments in different states don't have enough funding. And so the federal government, through the KHIG and TIC Act, will give some scholarships to those states. But there is there may be some influence from if the federal government is increasing, that the state might increase or maybe even decrease funding on a particular subject. So, but I would say there's pretty much no correlation.
Thank you. Can you provide a short synopsis on the CDC Pfizer vaccine meeting outcome?
Yeah. So about, when was it? I guess it's a week and a half ago. A group of advocates were invited by the CDC to go to Atlanta to put a list of questions together for the CDC, FDA, and most importantly, Pfizer, who is running phase 3 clinical trials on a Lyme vaccine. And so Pfizer had not talked to any of the Lyme community before. And so Sue Visser, who is a great person inside the CDC, she came up with this idea to try to pull together seven folks. One of them was myself, and six plus six other people to put a list of questions together about the vaccine, things that we all are concerned about. So at Center for Lyme Action, if you were on our mailing list, you responded to a survey. We had 335 responses to the survey. So thank you for all of you that answered the question. And I took all of those questions and brought them to this meeting at the CDC to ask to basically be added to this list of questions that were being posed to Pfizer, CDC, and FDA about the Lyme vaccine. So the outcome was actually quite good in that we were able to put this list together. It's probably 50 or 60 different questions. The CDC is compiling the results of that meeting, and we expect that the questions will all be answered immediately, but they will be answered over time. The good news is that the CDC is jumping on this early because the vaccine isn't expected, if all things go well, to be available till late 2025 or maybe 2026. So they're working on this, pretty far in advance, which is good. So we should be hopefully starting to get answers to a lot of the questions that all of us have about this vaccine.
Bonnie, I have a question from a viewer who is curious if any of the research and funding can trickle down to the physician level, physician education. Is there any mechanism to ensure that frontline doctors become aware of the research and more aware of the emerging treatments?
Yeah, so physician education comes from a bunch of different places. In the federal government, it would be that the CDC does physician education. They have physician education courses. Of course, there's private organizations like ILADS that do physician education, and then there's also private foundation like Invisible are doing. They do CME courses for physicians. So in terms of the actual federal funding that we're working on right now with regard to Center for Lyme Action, a small part of the CDC budget does go to physician education. But clearly more needs to be done. And I think we all recognize that.
Okay, we've got one last question about, looks like the vets admin. I'm not sure that I completely understand it, but I'm going to read it the way it is. Have you considered the vets admin? A nurse friend with long-term Lyme has raised this.
Yeah, in fact, the Department of Defense program, the CDMRP, it's congressionally directed medical research program. They have a tick-borne disease research program, which is funded at it's kind of a small level, $7 million, but they funded some great research through this program. Anyway, the reason that the Department of Defense is very interested, they're very interested in this for current service members and retired service members and their families. So they that program would, is basically designed for to really focus on the issue around the military. Whoever's asking the question, Pat, hi Pat. I would love to chat with you, whatever your ideas are around the VA. There are obviously VA hospitals that could be sites for clinical trials and things like that. But I would love to chat with you about any ideas that you might have for the VA.
Bill, I've got a couple of questions that came through. And generally, and I guess this would be for you, Bonnie, what is it going to take to for Lyme to get the funding levels that other diseases get? Is there a secret sauce? Is there a tipping point? Do you have, maybe an outlook 3-5 years of where this could get us?
Well, in order to make significant progress, I believe we need $500 million to $1 billion a year in order for Lyme and tick-borne disease, like full stop. There is a lot of, I've been working on this for about a dozen years now, and I've seen a significantly a significant increase in the number of projects and the quality of the projects that have been ongoing since I started working on this. So there's a lot of really good things that are happening, but we need more. I would say that that we're starting to see some sort of tipping point because the federal government is trying to be proactive in thinking about Lyme and tick-borne disease. In fact, this year they coined a phrase, infection-associated chronic conditions, which looks at Lyme disease in comparison to COVID and ME/CFS, noting that the symptomatology of all of those diseases is very, very, very similar. And so there's probably some commonality across all those diseases. So when you start seeing the federal government sort of innovating a bit in those kinds of areas, I think that we are in the tipping point. I think we are I think that's now. I think it's what's happening now.
That's good. Who coined that phrase, infection-associated chronic symptoms?
Well, I don't know exactly who coined it, but there was a conference that was occurred last June at the National Academies for Science, Engineering, and Medicine. And that was actually the theme of the conference. It was funded by the CDC, HHS, and the Cohen Foundation. And they invited top researchers across the United States to speak on the symptomatology and key research that's going on for all of those diseases, which seems to be overlapping. There's a $1 billion fund called Recover, which is funded through the NIH for long COVID, and a lot of those studies, or some of those studies anyway, are using Lyme disease, persistent Lyme disease, as a comparator disease versus COVID to try to figure out what the mechanisms are and try to figure out how to provide some treatments for those illnesses.
That's good. Looks like I got one last one here. Have you given any thought to State of Lyme Disease Research in the United States 2.0, your next updated version? Is that in the works currently, or when can we have this again?
Yes. What do you think, Nicole?
I think that, we would love to figure out how to stay on top of it. It's a huge need, to stay on top. We're hoping we presented at iLads, as you mentioned, and we're, hoping maybe we can do something similar at the upcoming iLads presentation and then share the information. So I think it's TBD, but it's definitely on our want to do list. I guess the other thing that I would say in terms of going back to the comment about training for doctors is that, the full paper is about 50 pages, has a lot of information in it. I like to encourage people to take it to their doctor, print it, if you don't mind. I know it takes a little bit of paper, but double-side it and bring it to your doctor. I've done that with a few folks just to show them what's out there. Because I think it is a good resource to look at the research that's out there. And to share it with clinical providers, to just change the mindset as to what's going on out there.
That's excellent. Thank you. Any other questions on your end, Bill?
I don't see anything on Facebook. I don't see anything here, so I think that's the end of the questions.
Well, we have a minute, and I just got one and the question is, it appears there's still a knowledge gap between what's happening federally and the state of Pennsylvania. So from a state position, our state position, where we have a belief that the Department of Health is actually behind and not as up to date, what would you encourage us to do at a PA Lyme advocate level to work with our state Department of Health? Any suggestions that could be, motivational for us?
Well, the paper actually might be helpful in conversations with the Department of Health. That it does summarize the latest findings in the state of Lyme disease, and so that may be helpful in your conversations. You guys are doing a fantastic job in having this bill, this SB 100. That's a very exciting bill to address insurance and awareness. So you're a top state. I think Massachusetts had something sort of similar, but if every state could to have SB 100, that we would, the country would be in much better shape in terms of Lyme disease.
I would agree. The grassroots mechanism that Lyme produces, it's the tentacles are very long, but it is challenging because half of us aren't feeling well all the time. The funding is not there to not have the technical abilities and access to some of the legislators. So, but my experience in working with the advocates in Pennsylvania is just very tenacious. I mean, the commitment level, the belief level, the tenacity, and really that's what it's going to take. So we really do thank you for taking the time this evening. Really thank you for the professionalism and the efforts that you both have put in between yourselves and your organizations to move this whole Lyme conversation forward. So thank you. And I think this was very beneficial to educating us at a state level what we can do to support you for the fly-ins in February. So my guess is we'll probably increase the ranks in Pennsylvania quite a bit because of this. So for that, thank you. What I'd like to do just in closing is what we will be doing in the month of April for the virtual impact session. It's going to be a virtual support group. It'll be a small group, virtual support group meeting. We will not be recording it. We have had requests from a handful of individuals over the last couple of weeks to hold one of those, perhaps once a quarter, that we can create an environment, a forum that people can come in, they can share, they can ask questions, they can learn. And again, it's designed to support those that are on the call. We do not record that. It will be a small group. So when you see that notice goes out, you'll want to register, right away to get one of those slots. So with that, Nicole, thank you very much. Bonnie as well. We really appreciate it. And Bill, for all that you do, thank as well. So good night and make it a good week. Okay.
Thanks,
Bye-bye.
everybody.
Take
Thank
care.
you.